Well, several Erie County Child Protective Services employees say that they are not paid enough and that their staff is stretched way too thin. Now, they say they want county leaders to address this so they can better serve children and families.
Join Side's Kelly Dudzik got some answers from the county executive today about these concerns. Kelly?
Scott and Mary Alice, County Legislator Lynn Dixon sent this letter to the county executive after hearing from those employees. In it, she says workers told her Mark Poloncarz would not talk about the concerns because he told them they should be discussed during union negotiations. While Poloncarz reiterated that when we spoke this afternoon, he answered all of my questions about workload and pay.
Concerns raised by Erie County Child Protective Services employees center around salary and job responsibilities. The workers argue low pay and increased responsibilities are leading to high turnover. One CPS employee with 2 years on the job said, "There are days that I cannot sleep because of the stress and anxiety of my caseload." Another employee said, "We are sometimes not able to take lunches." And a caseworker with a caseload of 30 said so many deadlines are impossible to be met. CPS employees in Erie County say their starting salary is just under $33,000, and they say the same position pays more than $48,000 in Onondaga County. Erie County Executive Mark Poloncarz says the Onondaga County employees do get paid more, but they're also paying for a portion of their health care.
It costs us basically $15,000 to $20,000 per employee. We could certainly offer additional funds to them on an hourly basis if they were willing to take on a greater responsibility with health care.
Poloncarz also told us the union rejected a tentative agreement not long ago in which each employee would have gotten a raise of more than $2,000. Employees are also concerned about workload. In 2015, my colleague Michael Wooten reported that the average number of cases per worker had dropped to 22, which was still higher than 15, the maximum the state recommends. Poloncarz confirmed Friday that the caseload is now lower than it was in 2015.
We, at one time, had over 5,000 cases. We're less than 2,000. At one point, the average caseload per employee was 50 to 60. Now it's in the teens, where it's supposed to be. So there has been a dramatic drop in the caseloads. If they have an issue with the negotiations that CSCA is doing, they need to talk to their union representatives.
I was able to get a hold of a CPS employee who was willing to speak with us on camera tonight, but she said she could only do that if she got permission from the Social Services Commissioner. It was after hours and I was not able to reach him tonight. Kelly Dudzik, Channel 2 News.